We're going to start with an overview. What is quantitative research? We'll talk a little bit about the definition and purpose of quantitative research. I'm going to talk about the types of questions that we can answer with this type of research and the types of problems that we might address, and give a little bit of the rationale for different kinds of research designs that we'll use in quantitative research. So in Module 1, we talked about this idea that our intuition is actually fairly good and fairly useful in solving some problems. But our intuition fails us when we're talking about large numbers of clients or complex patterns of cause and effect. For example, complex patterns of cause and effect, the relationship between interventions and outcomes. So at the end of Module 1, we talked about the way that good intentions may, in fact, end up hurting our clients rather than helping our clients. We talked about the idea of Simpson's paradox, which was the paradox of multivariate thinking or complications of multivariate thinking, that our intuition can help us think about the relationship of one thing to another, but when we think about 3 things or 4 things, the patterns of relationships end up being very complex, very paradoxical, and sometimes counterintuitive. We ended our discussion in that module. We talked about the idea of diagnosing disorders and how there might be some apparent intuition, but again, there were counterintuitive results if we thought about situations in which there were rare diseases or disorders with low base rates. So in contrast, quantitative research can be seen as a way of documenting the intuitions that we have about the relationship of possible causes and possible effects. We want to estimate the size of these relationships, so give precise estimates whether the relationship between, for example, a treatment and an intervention, a treatment or an intervention and an outcome, whether that relationship is large, whether it's moderate, whether it's small, whether it's positive, whether it's negative. Quantitative research is also going to let us find the influence of other factors that we did not suspect were at play. And it may mean that we discover that our initial beliefs about the world are sometimes overturned. So to begin, we're going to talk about perhaps what's the most common research design, what we call one group and one time point. So we think about some kind of event. In this notation, this X refers to some kind of event. And just as a practical or concrete example, I'm going to talk about these adverse childhood experiences, which get abbreviated to ACEs. Our experiences like being abused or maltreated as a child, being neglected, having a parent with mental illness, a parent who's incarcerated. And so we might observe, the O stands for observation, we might observe that there's some kind of effect on the mental health of our participants, or that after exposure to some kind of adverse childhood experience, participants in a study have lower mental health. Now, as we go on, I think one criticism or one concern we might have about this kind of research is that we think, well, perhaps it's obvious that exposure to adverse childhood experiences is going to result in lower mental health. And the kind of problem that we want to think about is we want to think about what particular adverse childhood experiences are particularly salient. Is it abuse? Is it neglect? Is it having a parent who's incarcerated? Is it having a parent who's mentally ill? Is it not having enough food in the house? What particular events are most salient? And then in terms of mental health, we can think across multiple domains. We can start to think about depression. We can start to think about anxiety. We can start to think about symptoms of post-traumatic stress disorder. So overall, the connections might be obvious, but more specifically, we start to think about what particular adverse childhood experience has an effect on what particular domain of mental health. So, and what we start to think about is to what extent can we make causal conclusions about the effect of this adverse childhood experience on mental health. That's what we're going to be thinking about as we move through various research designs. So we're going to talk in this module overall about what we call observational research, which is kind of naturalistic research, watching things unfold, using here this example of adverse childhood experiences and how they might relate to mental health outcomes. So we're starting with some basic research designs, and again, we're recapitulating what we just said, talking about this one group, one time point design, that we might think about exposure represented by the X, and then some kind of observation of mental health. What we realize is that this one group, one time point design, we don't have an observation, we don't have earlier observations of how people in our study, participants in our study, were doing early on. So we think as an improvement on the one group, one time point design, we think about the multiple time point designs. Now we can have many, many time points before the event. We can have many, many time points after the event. The most common situation is where we're going to have just one observation beforehand, some kind of pretest, and then one observation at the end, some kind of post-test. And this gives us some ability to ascertain how the participants in the study were doing before the adverse events occurred, and then how they were doing after, what the change was after the adverse events had occurred. It's also an improvement in our research design if we think about adding a second group, and this is a group for whom the event that we are interested in, for whom that event did not occur. So we think about adding a second comparison. Sometimes we call this a control group, but essentially it's a group for whom this event of interest, in this case these adverse childhood experiences, did not occur. We compare them to a group for whom these adverse childhood experiences did occur. And again, what we want to ascertain is this group relatively similar to this group? Or we hope that in our study we have one group here, one group here. The two groups are relatively similar in terms of their initial mental health, perhaps other factors, poverty or lack thereof, neighborhood poverty, neighborhood socioeconomic status. This two-group design lets us look at two relatively similar or equivalent groups of people and ascertain what the effect of an event like exposure to adverse childhood experiences might be. So in this last slide of this session, we start to think about not events that naturalistically occur, like exposure to adverse childhood experiences, but rather an intervention where we might want to study the effect of an intervention. For example, we might think about some kind of group-based or community-based intervention that lasts for 4 or 5 weeks or 10 weeks, where individuals meet in groups. And we want to think about what is the effect, looking from baseline, what is the effect of that intervention or treatment on the mental health of those who participate, and what is the effect or treatment for those who didn't participate in the treatment. This situation is what we call a quasi-experiment. And that's the reason that we have this A on the slide. The A denotes that there's some kind of assignment. Some people are assigned to participate in the treatment. Some people are assigned not to participate in the treatment. In a quasi-experiment, we talk about the assignment being made potentially by the interviewer or the researcher. The assignment might be made by the clinician. A clinician in an agency might decide that some individuals would benefit from this treatment. Those people get assigned to the treatment. Some people, the clinician might decide, would not benefit from the treatment. Those people get assigned to the control or comparison condition. Or in fact, the participants in the study or the program might make their own decisions about whether they want to participate in this intervention or not participate in the intervention. So this is a stronger design for assessing the effect of an intervention or treatment, but the important limitation of a quasi-experiment is that the individuals at the beginning of the study were not 100% sure that they are not different in some way. There might be unobserved differences between those who participate and those who do not participate. There might be unobserved differences in terms of their family background, their family history, their motivation, their income, characteristics of the communities that they live in, and we worry that those pre-existing differences might actually account for any differences that we see at the end of the study.